Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for today's Platica called Tenemos Voz. We have a voice on Latino peer recovery. With me today is our esteemed co-host, Mikayla Trujillo, who is the Program Manager with the Office of Peer Recovery and Engagement. She will be introducing herself shortly. NALBA is a nonprofit agency dedicated to the well-being of Latino individuals, families, and communities across New Mexico and across the U.S. Our mission is to address the disparities and barriers that affect the behavioral health and well-being of Latinos. Today, we're excited to present our Placticas series called Tenemos Voz on Latino peer recovery and the journey of hope and transformation. Plática is the Spanish word for conversation. Today, we highlight the work of our guest speaker and her experience in working with individuals in recovery and in need of services in our communities. NALBA would like to thank the New Mexico Human Services Department and particularly the Office of Peer Recovery and Engagement for making this series possible. Each month through June 2023, NALBA will host speakers directly involved in recovery who will share their stories, their insights, their experiences, and even help us out with some resources so we can then share that with all of you who are live on Facebook. So let's begin, and we're going to have my co-host to enjoy working with every chance we get because this is the work we're both passionate about, and that's Mikayla Trujillo, who's going to introduce herself as well as our presenters. So Mikayla, over to you.
Thank you, Mr. Fred. Hi, everybody. Hi, Facebook world. Good afternoon. I'm so excited today to be here live with NALBA and Mr. Fred and this amazing guest today that we have. That we're just like we're excited to hear about her journey for sure and her professional career right now as a peer, Mikayla Trujillo. Let me give you just a little bit of background. I come to you from the Office of Peer Recovery and Engagement, Woman in Long-Term Recovery, an employable woman in the community and in the state of New Mexico. And I'm very honored to be able to lead with experience, strength, and hope here in New Mexico, and to partner with NALBA always. This is the joy of my week when we get to do these pláticas. And so I thank you for that. And just a little bit about Miss Mikayla today. She is a CPSW, and she is a community health worker, a CCHW. She has strong roots in Albuquerque, New Mexico. Mikayla is a peer with lived experience in overcoming adversity, which includes mental health, substance use, incarceration, which ultimately led her to become a CCHW in her community, and the capacity building coordinator at NACHW, which stands for the National Association for Community Health Workers. Her passion began as she re-entered her own community and tirelessly assisted those affected by mental health, precariously housed individuals, system-impacted youth. Wow, this is going to be an amazing day. And employment, seeking returning citizens and achieving their personal goals, located in a small nonprofit in Albuquerque, which she helps keep very close to her heart and visits regularly. She continued her successes at UNM under a prison hepatitis elimination program, hepatitis C, as a program coordinator, working with incarcerated peer educators at all 12 points across New Mexico, as well as returning citizens in our community, providing resources for peers on adult probation and parole supervision. Mikayla is so proud and to be advocating for the many previously incarcerated people seeking a valuable role as a CCHW in their communities. Mikayla is also currently leading the Johnson & Johnson CHW Leaders Project and offers mentorship and support to the inspiring and groundbreaking individuals in the CHW leadership community. So proud of you, Miha. So proud of you, and very excited to hear and learn from you today. So with that being said, please tell us a little bit about yourself after that amazing introduction.
Oh, thank you so much. It's been such a long time. I've been a fan, so I'm so happy to be here. Thank you for having me, and thank you for the invite. Um, so as you've heard it from my bio, I was raised here in Albuquerque in the South Valley. I have identified with lived experience, returning citizen, a peer, a community health worker, and most of all, an advocate. Um, I come from a family of generational substance use and crime. And so a lot of my youth years were spent very challenged, troubled, seeking role models in all the wrong places, learning all the wrong life skills, and kind of just glorifying this lifestyle. So by the time I was 17, I was diagnosed with opioid use disorder. I feel like I struggled so much with sobriety at a young age because there was very many forced attempts and most of the time I was punished by systems for having an addiction. So years and years of this kind of turmoil went by, and by the time I was 21, I was involved in my first medicated assisted treatment. But that same year, I had lost my mother, and it sent me into a spiral. I was using more than I ever had. And by age 25, I was sentenced to the New Mexico Department of Corrections and spent 2 years in prison. At that point, I was really able to do a self evaluation, kind of taking my own inventory, figuring out what role did I play in my incarceration and the way that my life had played out until that point. I used that time constructively to work and heal on my traumas and my personal mental health. And from there, I went on to constructively build peer support classes and programs that focus on reentry, recovery, and healing the mommy heart. And 2 of those classes are still in place at both of the Women's Department of Corrections facility to this day, as far as I know. So that's awesome news. And thankfully, after I was released, I made connections with local community-based organizations such as Albuquerque Center for Hope and Recovery. I was given an opportunity to work there when I didn't have much to give them, but there was a few informal interviews that happened, and I realized that they were interviews after the fact, but really just being able to demonstrate my character, my work ethic, and was enough for these folks to believe in me. And I did work there happily for 3 years as a job developer, peer support worker, case manager, community health worker. I really feel that I was able to grow in that role in that organization and really just raise up myself and others. And then after that, I was given an opportunity to work with the UNM Project Echo Peer Education Program, which is the only peer education program that is able to visit incarcerated individuals in all 12 prison facilities. And their goal is inmate wellness, community wellness, is prison wellness is, I think, the title of the curriculum, and it's particularly based for Hep C, which goes untreated for many, many years and has side effects that are usually invisible, but have long-term detriments if not cared for. So with that, I was really able to find a connection and give back to the people that were just like me and have been in those positions that I was in. And following that, I was given my greatest opportunity yet, which was to work full-time for the National Association of Community Health Workers. I had been involved with them on volunteer and contractual basis before, and I believe that it really prepared me for the role that I play now. I've actually just got a promotion, so that bio wasn't even accurate. I think they're calling it Leadership Development Manager. Yeah, something fancy. But working under the Johnson & Johnson contract, this is a contract that is our race to health equity. So we're helping people of color address all the social determinants of health. We do this by really empowering 12 CHWs from across various sectors, regions, cultures, and community health expertise, and unifying them across leveraging technology platforms such as Zoom, and of course getting together in person once or twice a year so that we can have that camaraderie, but really being able to help them network with each other, bounce ideas, listen to the concerns of CHWs, which really doesn't happen very often. So my entire lens of community health work has just been expanded far beyond what I had known in Albuquerque. In this position, I get to support CHWs who are in rural Alaska, Mexico border, Texas-Mexico border, the Inland Empire in California, all the way to Rochester, New York, back down to North Carolina. So I have definitely been able to walk alongside them as they really just I can't tell you, I think the best way to say this is like they are in the business of saving souls. There's no task too great, too small in order to help an individual. And some of the things and the ways that they've helped individuals, I know CHWs who work with current and ex-gang members, and she's just this sweet little church lady from Connecticut, and I have to ask her when she's telling me that she's crossing these boys across enemy territory to get services for their food stamps, GED, things like that. I'm like, do you ever feel like your life is in danger? And she's like, every day. And I'm like, oh my God, we got to find some insurance for this lady or something. She needs to be protected, right? So just really being able to learn from their expertise, grow in my career, open my eyes, my lens, my scope, and I kind of get to go to work with them. So I'm very privileged to hear about all of the things that their successes, their barriers, all of that good stuff. I also have connections with the Albuquerque Justice for Youth collaboration that's centered in keeping youth out of incarceration and in the capable hands of their community. I serve as a co-chair on their board and senior youth mentor to the documentation team with La Placita Institute and ACHR. And then if that isn't enough, I also find purpose hosting life skill classes to people who are experiencing homelessness and who are currently using substances with the City of Albuquerque Violence Intervention Program and Dope Services Harm Reduction Program of Albuquerque. And those guys are my heart. Like you said, this is your favorite part of the week. That's my favorite part of the week, is going to go talk to them. And I get to go tell them about all of the nonsense and business that run around from the national platform. And they're the only ones that get it, so understanding. So I love those guys.
Oh my gosh, that's, you know what, Mikayla, so thank you, man. And I hear your fire, your passion, on both fronts, so Mr. Fred, I'm going to turn this over to Fred because I know that he's, how do we call it? So you're chomping at the bit to ask the next question. You're blessed woman, Mikayla, and thank you for being up here also también, because I know it interacts, because, and then you mentioned ABQCHR, our wellness center. They are a beautiful wellness center up in Albuquerque, and we're just honored that they gave you your star. That's amazing. So thank you. Mr. Fred, andale, I'll take over.
Oh my gosh, all I could say was, man, I was having to keep track of all the things that she's doing. But she's on fire, como dicen en inglés, no? She's on fire, and that's exactly what you want to see in folks, because it's their passion for what they're doing that drives them and motivates them, right? But Mikayla, you said something that, it's very powerful, right? That experience, and thank you for your honesty, your candor about, sharing that, because of death and grief, how that had such an impact on your life, right? And then that, as you said, as things spiral in the wrong direction, you took that energy and then redirected it to where you're at today. So that's kind of your unique recovery journey, right? And how did you took those experiences and then also sorted through how to get on the road to recovery. And so say more about that, because imagine all the folks that are going to be listening to this, because we are recording today's Platica, and then we get to replay it. and we get to reply it across the country, right? We have folks from Chicago and North Carolina, California, Texas that listen in. And so all of us have these things in common, right? Is that it impacts our life. But what's particularly important is how do we then regain and restore this wellness path? And yours is very unique, right? And so kind of give us an inside picture of what that looks like for you when you were starting to redirect your energy towards where you're at today. Describe that a little bit for us. That had to have been very powerful.
Yeah, absolutely. So by this point, I had spent about a year, or maybe a little less than a year in the Department of Corrections. And to be honest, I thought that I had an earlier release date than what I did. I thought somebody messed up on paperwork somewhere and I was going home, right? And then one day my world came crashing down and they're like, no, you're staying here for another year. And so I didn't have family support. So I didn't have anyone to call on the phone. Nobody put money on my books. So I knew that I was going to have to work while I was in doing time. So of course I went for the highest paid job in the Department of Corrections, which is $1 an hour, working as a, I think they called it a peer mentor in the education department. I was not qualified. You have to have a GED just to meet the minimum requirements for that position. And my previous supervisor, who was the director of reentry at the time, spoke to my GED teacher and he's like, what do you think about her? And she said, hire her. She's going to get her GED. I guarantee it. And so with that, I was able to meet my own peer mentor, if you would, Renee Chavez MIAs. If you haven't interviewed her already, I suggest that's the next one. So she helped me so much. It's just to not only as like a mother figure that I was craving at the time, but also just like a role model. She reintroduced me to spirituality, and that was really my key guidance for me personally with healing and finding my path, was being okay with not having all the answers of why did this happen to me, why me, why my mom, all these things, and just really being able to look for answers that come from a higher power that no other human being could have provided to me with such closure and clarity, right? So really taking that spiritual inventory, cleansing myself of all of the negativity. Like, you're so pure, you have an opportunity to really be in tune with your mind, body, and spirit. If you look at it like that when you're in prison, right? Not everybody does. Some people are hostile, get anxiety and all this stuff, but there are some peaceful and calm moments where you get to really live in serenity. And then you come out here and you're like, I could just want that again. No phones, no internet, just me and my passion and my thoughts, right? So being able to really look for opportunities in that kind of environment, I think that was probably the biggest piece. Shifting away from all of the negative and catalysts that occur within the Department of Corrections, fights, girlfriends, drugs, you name it. All these things were another piece of my generational history. Before I had got to prison, they already knew I was coming. They knew I was somebody's niece. You know what I mean? They knew I was so-and-so's daughter. So being able to separate myself from what had already been established in that kind of atmosphere was definitely different. There was even times when I thought my aunt was going to end up in the Department of Corrections with me, and she was going to see me in the education department and just like disown me, right? Like, what are you doing here? But I feel like really creating that resiliency, that self-motivation, it's truly a soul shift and really finding new hobbies, new friends, new support systems, and understanding that sometimes your greatest support system is not your family, it is a stranger. Some other pieces that come to mind about the unique aspects of a recovery journey, mine in particular, is the first year. Like, I don't think anyone talks about like the first day enough. Like, what do you do after you don't use anymore. Like a lot of these things that these are patterns. These are they're compulsions, they're rituals almost, right? We have to do this to feel better. And so really kind of like relearning that and taking the first year of recovery is so important. Taking that seriously, keeping that year just for you, being extra selfish and being patient with yourself, I think is so important.
Yeah.
I'm sure people have said this before, but there's no magic program or pill. Like, healing must be done on an individual's spiritual journey, while processing and finding closure for trauma, mental health issues, and most importantly, finding forgiveness for yourself and others.
Oh,
Yes.
wow, that's really
Yes, that what you talked about was an inside job, literally. What I heard you say also was taking direction from a woman who had been through the same thing that you had been through. And for me, that hits home for me too, because I needed direction from somebody that didn't judge me, from somebody that had walked my walk, from somebody that of course was going to tell me not what I wanted to hear, but what I needed to hear.
Yeah.
And for me to please hit my knees and get to business of living or dying. And so me too, I have a lot in common with you, Mikayla, even though I didn't hit the behind the walls, but I hit behind a lot of walls of jails and institutions, and that was the next place that was on my list, or 6 feet under. And I can say that today without having to be embarrassed. This is a place where we can be transparent, which you just have been. And that's why it is called my favorite part of my week when I get to host with Fred, because we get vulnerable here. We talk, we're transparent with our peers and the people that listen, that are out there in the world listening to us. You, I think, in turn, have been a mentor and were able to get mentored, by somebody who cared. And because of that, now you're a walking resource. And that leads me to the next question about resources. So thank you for being who you are for all of us. And the rock, that rock that's there, even after you've met folks, you're still there. You're not going away. And you changing your habits, because you said it's those compulsions. When we turn those into what you just mentioned was a higher power, whatever you chose, whatever spiritually, mentally, physically, the hole in the soul, got smaller and smaller for me, because I got to fill that with stuff that feeds me today. Just like you gave me chills, just so you know. So resources that are available in your community now, when someone that's pursuing recovery but can't, they say I'm all out of options. Where do I go for resources like that? Can you name a few for us, and to the listening audience? And Freddie, did I cut you off by any chance? Because I would never want to do that. I just got so excited after she started talking about, spiritual stuff.
No, you're we both get excited, right? Porque lo que pasa es when a person is being so honest and upfront, that's exactly what we want to be able to have this plática do, right? Is role model for others what they're feeling inside. Porque muchas veces, many times we're feeling this, but we're not saying it, right? And I can hardly wait till you respond to Melicia's question, because I want to share with you something somebody said in the chat, because it's it gets right to the heart of what we're talking about here. But no, go ahead. No, please, Kayla, go ahead and answer and share with us.
Yeah, absolutely. So when we think about resources, there's really not a limit of resources that you can gather while you're in recovery. Recovery is something that has layers. So you have to keep going layer and layer and layer and layer. So you're going to need many, many resources, right? There's no one-stop shop. There's no magic program. There's no magic pill. And you're going to need a whole support team that's going to help you through this recovery process. So I did a little bit about some name dropping and then just some general resources for the Albuquerque area. So of course, we've talked about how much peer support has been instrumental piece of my recovery, both in prison and out of prison. I was at ACHR yesterday. You can't keep me out of there.
That's awesome.
So just always just it's a drop-in center, which makes it
Yes.
easy, so you can go in without an appointment. It really starts the baseline of recovery. Even if all you're willing to do that day is just go in and fill out this information and talk to somebody who will listen to you and feel heard. That's step one sometimes, is just being able, like you said, to just voice what we're going through and how we're feeling. Sometimes we've stuffed that down so far that it's hard to actually verbalize it. The ACHR, Albuquerque Center for Hope and Recovery, 912 2nd Street. For those who don't know, they can help you start making your recovery plan. Preparing that, they can find resources for additional recovery services. They also have in-house case management with UNM pathways, job development, life skills. And the most important is they have caring staff who understands what you're going through. Another layer of recovery could be medicated assisted treatment and detox facilities. And often these programs carry a lot of stigma with the recovery community, but they are essential pieces of early sobriety, and they do ease the physical ailments of detox. My advice would just be to stick it out for as long as you need and create a transition plan from any medication after a certain timeline that you and your provider, find fit. The next layer could be counseling and behavioral health services. And we all understand that finding a counselor is challenging, and it often takes some work before you are matched with a counselor you feel comfortable with. But you should always keep trying until you do, because it doesn't mean that there's not a counselor out there for you. It just means you haven't found them yet. And they really provide the value for having a counselor or behavioral health professional is having that safe space where you can communicate your thoughts, feelings, and emotions to a trained professional who's sworn to privacy. And that's such a relief when you're in early recovery and even long-term recovery. I still go to counseling. Favorite part of my month. And, hopefully it'll prevent some reaction to these uncomfortable feelings and emotions that occur throughout the journey. The next layer is social services and case management. So when you're seeking support, there are multiple social determinants of health is what they're called, layers of services that you may need. So if you need an ID, birth certificate, job, housing even, they need to be worked on, and sometimes they need to be worked on concurrently at the same time. So it's helpful to have a support system like a case manager who can help you organize appointments, gather information, documentation on your behalf. Maybe they help you with language interpretation if you don't understand what some of these services are asking you for. And just really an advocate can truly help in achieving the success of recovery. The next one I would lift up is job development. It's a crucial layer of recovery. People need to have a purpose every day, waking up with a purpose, have something. Somebody's counting on me. I have to be here because Fred and Militia are looking for me on Facebook today. That's my purpose for the day. And it just really helps, equip folks with skills like self-motivation, determination, and helps them become financially independent and create a sustainable income for them and their families. And my last piece, which is like an ongoing piece, is life skills. And that's very broad. So never stop learning. Like now that let's say we're at the point of recovery is getting smoother, we're not physically ill anymore. We can't forget the details, and we are no longer using every day. So we might want to be more social and find a community. And to do this, we have to educate ourselves on various topics like nutrition, coping with anger, effective communication, healthy parenting, money management, meaningful relationships, healthy hobbies. And there's just so many support groups and peer groups that are designed to create this solidarity. So I definitely encourage seeking those out.
Well, all I could say is that if I hung out with you for a day, I'd probably find out about every resource that there is in Bernalillo County, you know. Um, but you're right. You're absolutely right. There are more resources than we realize, and peers can help shorten that journey, right? In other words, they say, hey, this is what I did when I needed this kind of help, or here's what I went when I needed this kind of support. And so your peers are going to help do that. And then you learn, your body of knowledge grows, ¿verdad? So you become kind of a resource expert. Like Melissa said, you're like a walking resource, you know, because part of that is been there, done that, and still open to finding out about more resources, right? And whenever you get to a point when you get to know all these resources, you're like a traffic cop, you know, you can direct people that way and that way and that way. Because really the question is, people want information. I've always experienced that what people lack is information. But what a perfect opportunity, right? To go to a drop-in center or go to your peers and say, you know, I don't know how I'm going to pay the rent, and I'm really worried about it because I don't want to get evicted. What am I going to do with my kids? And, you know, these are just everyday experiences that are, as you said, they're tied to social determinants of health. There are conditions that we live in that were sometimes out of our control, things that impact our lives. But these are the things that cause us to have stress. These are the things that cause us to feel worrisome or start to feel anxious about, right? But, you know, what you're talking about is recovery helps you to look at how to manage and cope with those things. And I want to share something that Socorro Rodriguez said. And welcome back, Socorro. We haven't had her here for a while, but thank you, Socorro, for joining us back. And I like what she said. She says, there's no magic pill. Being generous is enough to forgive ourselves. And it touches on what you talked about, right? Kind of the spirituality of how do we deal with some of the feelings we have about remorse, guilt, or things that we carry on because we can't resolve it in our own minds, right? But the forgiveness of these things that we've done in the past help us then say we can change the story into the future, right? And that's really a powerful process, because whenever you walk through that door, oh my God, the recovery that you're going to experience is just phenomenal. So thank you, Socorro, for joining us, because, you know, she said, how she says, I love this chat. And the reason she loves it is because she can relate to what you're saying. So Mikayla, just thank you for enlivening our listeners, because part of that is that in this live Platica, what happens is people will continue to post even after today's session ends. So please check your Facebook and respond back to folks and continue to be that leader that you are. And congratulations to be a Johnson & Johnson a leader in that environment. Says a lot about what more we all look forward to in the future about your role as a leader. So where you are today, guess what? The 18th of January, 2023, I want to hear what you have to say in January 18th, 2024, so we can see what has happened from here to here, because you're now taking a leadership role. You're going to be mentoring others, you're going to be helping others, and in ways where it's both national, right? Because the National Association of Community Health Workers is across the country. And you must get excited to talk about people who you've never met from other states, right? Along the border, Oregon, Massachusetts, North Carolina. And because that's what we find that we have in common across the United States. We're all experiencing these circumstances because of what is unique to this nation, but what's unique to our experiences. So I want to ask you a question here about, where do you see yourself in about 5 years, right? Because right now you're in the middle of doing this, right? It's like you're at the kitchen, right? You're cooking this, you're doing this, you're doing all of that. But where do you see yourself in about 5 years from now?
Oh, that's a great question. So I have my own LLC. So possibly flourishing that out in 5 years could be completely my own boss. But in 5 years, I will have raised up a league of CHW leaders who are managing mini programs, pilot programs in their own community, and advancing the CHW professional identity. And we're doing that through providing, taking the, all of politics. Now that I'm on this national level, we get all the, we get all the bureaucracy and all this good stuff that goes on, right? But you and I as peers know the impact that can happen should we take out all of this, nonsense, politics, grant funding. You are binded by your RFP to only do these objections and these contractual obligations. And your supervisors don't want you to do anything other than that, right? So really just, I have given my 10 Johnson & Johnson leaders the opportunity. One of the things that they had, I've always invested in them and really kind of pulled out from them. Although this is a contract position and, you spend less than 10 hours here with me, what do you want to get out of this? How can I make your time meaningful? And so something as small as having a suggestion to learn how to write their own grants. Community health workers and peers want to learn how to write their own grants because they understand this is how my role is going to be sustained. So they want to be able to contribute to that, right? And should they, of course, they should have the authority to do so. And so I didn't know how to write a full grant myself. I've been invited to, collaborate on a certain index of one, but the whole thing is very daunting and overwhelming for myself as well. So I, found some creative ways to find like a PowerPoint template that's very simple, like insert budget here, insert objectives here, insert outcomes here, timeline, all this stuff. And I did it first. And I've always, as a leader, I never would ask anybody who I support to do anything that I wouldn't do. So I always try it before I buy it, make sure it's something that is realistic. And then I send it out to my network. So 10 of my CHWs have put together grants proposals that stayed all internally, and they've let us know how they would spend $20,000 if they had the opportunity to do so. And they're going to mobilize, take action. A lot of what their work is doing is also raising up CHWs. So I'm empowering like an executive director of a nonprofit to be able to raise up 5 CHWs specifically with domestic violence background so that they can work directly with folks who are affected by domestic violence, like avenues like that. And then, we'll do all the good stuff like research, data, evaluate one-pagers, white pagers, all this stuff to kind of my vision and my legacy with the National Association of Community Health Workers is really to leave behind something that I may not ever see the fruits of my labors for, but it's something that's going to be sustainable for generations and generations to come. So that's something that I find meaningful. I also have a totally random side passion, which is actually financial education. So it's something that I'm just getting introduced to myself, but that includes, insurance policies and long-term financial stability for you and your family. And which I believe is not talked about in our youth, our culture, our anything, not nearly enough. So really just teaching people the lessons that I learned the hard way, how to prepare for death. We've said I've experienced it, but there's a lot more than just the emotional factors, the financial factors. And really, my passion is not going to be helping people who have hundreds of thousands of dollars saved get $1 million policy. It's absolutely educating, the 65-year-old woman who's still working at Walmart because retirement, Social Security has failed them, so who knows? I'll be all over the place. Fred, you're muted.
It sounds like you've already given it some thought, right? And that you're looking to inspire others, but you're also very clear about saying you want to play an active role in making a positive change in other people's lives. But somehow it continues to fuel you, right? But thank you for sharing a little bit about how you can envision the future. So Melissa's probably already got a question for you about what she wants to kind of tap into your brain with now, because we still have a few minutes with you, and this has been very exciting to kind of hear what you're experiencing in your mind, because what makes you different from most other folks too is you're a doer, right? And that's usually what draws people to you, right? We all have lots of things to say. Everybody has an opinion, and we all like to say things, but where we tend to gravitate is to the people who do things, because the doers are brave enough, courageous enough to take that extra step. Even if you might be feeling anxious or insecure or feeling as if though, hey, I'm gonna have to put myself out there, but you're a doer. And so just know that what you're doing is really important to our community and for you. It's part of your recovery, right? It's the restoration of your sense of self-worth. It's the restoration of your sense of, you know what, I'm making amends for the things of the past, because that's the beauty of recovery, right? It gives you more than one chance, right? Because you have the rest of your life to be able to do that. So, Melissa, I know ya tienes una cuestión listo. Yeah, you're already ready with your question, so I better bump it over to you.
Well, it's more kudos. It's just more kudos for Mikayla, because there's three things she mentioned: higher education, big time, more growing herself professionally. She talked about grant writing. Do you know how scary that is for some of us? I mean, like grant writing proposals, when they mention that, at a higher, I am sitting at a position where all those words that you just mentioned come and I get scared. But the good thing about that is that I'm not going to sell myself short, for one, and that I look to my leader to help with that kind of stuff. And we both have those today. We had those, we opened ourselves up enough to, first of all, want to live and learn so that we could. And I love what you mentioned about CHWs, and not settling for less than a living, well, but not more than a living wage. And educating our seniors about, because I am an older adult. What I heard in there was, there's an opportunity, even as a CHW, because you are a peer, even to that's one of our endorsements, the Certified Older Adult Peer Support. I know that when I get to pass the torch to the next peer leader for the state of New Mexico, my passion will be working with the certified older adult peer support workers, or in my community and all communities, and educating them on those insurance policies that you just talked about, and on ways to leave their children, down the road, funding for whatever they need to pursue in their lives to raise their children, keeping the lights on at our home. What I heard you also mention, Mikayla, was, when the last part of our four, what SAMHSA calls home, health, community, and purpose, you talked about purpose, and you did it in the exact order that it falls for folks that are living this amazing dream called recovery. And I'm thinking that what I was thinking now while you were speaking was, 14, 15 years ago, nobody was able to talk the way we're talking on the platform, the way we're using. So not only am I blessed to have met you on this journey, but your dreams and your goals and the where you are headed, watch out. Watch out, because there are more of Mikaylas out there. There's more of militias, and the people that have walked out before us, like you, Mr. Fred, the giant that we talk about and the shoulders, it's because you believed in us. You were the jefitos and the professionals that believed in people like myself and Mikayla. And, my sponsor said it once that, we clean up well. We clean up so well, and when our hearts are open to that medicina that we get from our the people that care about us and the employers that never gave up on us, we became different people, but not different people. We just people with dreams and goals, and the morals and values that we were born with. We got those back, and I'm just going to throw that out there, that your mom, wherever she is right now, is super proud of you, and she's guiding you along with all the mentors that you have in your circle right now immediately. And I can't wait to visit your 501. I can't wait to meet your team of CHWs and peers. I'm sure that you will invite us all in to be part of your world. And at a national level, you are rocking it, girl. So, the real part of me is just right here, just being your biggest cheerleader, for one, and thank you for letting us learn from you. So it's not too much questions. I just love the truth and the way you have came here today to rock our world. So, and bring us a little bit of your corazón, because I mean, I knew you were a peer, but and I knew you were out there. I wish I could like personally meet 700 of us, because that's what we are now. As of last Friday, there's 700 of us peers in New Mexico doing things like Mikayla getting her CHW, going back to college, being on that, the ECHO, going back into our 12 prisons, and getting, allowing our reentry people to come back out and do good things, and in this world and in our communities. So. Yeah.
And I just want to put a shameless plug out there of how essential peers are to every component. Every public health interface that you can think of needs peers. And when I walk into a room, that's the first way that I introduce myself. Not like you need that much detail to know that I'm not like the rest of the academia folks in the room, but you're going to know, because that is something that is my truth. And that's my greatest strength, right? Because when you speak your truth, like, how easy is it for someone to be like, oh, she's a felon, she's a junkie, no, I'm a person with lived experience. I'm a returning citizen and a person in recovery. So therefore, I've taken away all the power that you have over my name and restored it into a strength, right? So that's like one of my first things. I'm a very, I've been invited to rooms that I never thought I would be in. I've been in White House made to save calls. I don't think anybody in there knows that I'm a peer, but a peer is in there, and that's incredible, right? So different places that I've had, American Public Health Association, I was a presenter for that. Never thought in my life that I would be able to come into a community full of public health jefitas, these 30 years of public health, frontline public health work, and walk alongside them and feel understood and welcomed. There's never been a time that I've been felt inadequate in rooms where people with master's degrees. In fact, it's quite the opposite. And I'm like, I can tell you that your master's degree was a waste of your 4 years, because I could tell you all the gaps in your program based off of my lived experience in 5 minutes. And it took you 4 years to understand how to treat another human being.
Yes.
Like, when I went to social work class the first time, I mean, I was like ready to quit my first day, because the whole lesson was this veteran teacher who she's famous in social work for CNM and Highland students, Teresa Jeffries, right? And her first introduction is very basically teaching how to treat another human being with dignity and respect. And I'm like, why do I have to be here? I don't need to be in this class. This is like, and if any of you guys need this kind of lesson, then you shouldn't be social workers either. Because you should, like, this is something that community health workers, peers, social workers, in some sense, we are born, not made, right? Like, I don't have a list of other qualifications that can support as well as my passion, right? Like, there's just, there's no amount of education that can, even if I had the best job, the best education, if it wasn't something that was fulfilling my purpose, I would not be smiling with you today.
Amazing. Ready? Do you have question? I mean, she's answered like the questions, part of it. I think that it's flowed amazingly today, and I just have a lot of gratitude for first of all, you're a powerful woman, Mikayla, and women in general, and that get to do these. We get to. I like saying that. we get to be where we're at today because people didn't give up on us and we didn't give up on ourselves, you know.
Absolutely.
That's amazing. Wow. Well, all I could say is that Mikayla knows how to cover a lot of ground. So it keeps your attention. And then two, she's motivated to be able to tell this so that you can feel like you're learning something new or about the opportunities that can exist. And so here's what we'll do is, Mikayla, now I want you to just kind of now pull it together in a way that helps you leave with the Facebook listeners what you want them to take away from today. Because really, if you think about it, oh my God, you covered so much ground. But you know, on the other hand, there's probably some things that you're going to say, okay, here's some essential things to take away with you so people can learn that, right? Because what happens is it sometimes just validates what they know. So they've learned it, but they just need to have someone who's already kind of walked that path to say, this is what I found really invaluable. It's advice, no consejos, as we call them in our language, right? But the consejos are important because you know what? People will trust the people who are honest about their own life experiences, right? Porque no nos creemos tan jaitones, as we say in New Mexico. You know, we're not so grandiose that we think that we know everything or that we ourselves haven't struggled. People like honesty. At the end of the day, that's really what they like, right? But I want you to now, for the benefit of all the Facebook listeners that will continue to hear your comments, to then say, what should they take away from today? So we're going to wrap up with that. And then after you've had a chance to do that, I always ask Melissa to kind of help wrap us up, and that'll, you know, help us conclude today's Plática, but it does not conclude the path or the journey that you're on. So, Mikayla, what do you want to have folks take away from today?
Thank you for that. So yes, I think something that I will draw off of is kind of when Melissa said, like, we have a decision whether we live our one life well or sick. And it's really up to us to save ourselves. And we have to take action today. It's not about tomorrow. It's what can you do today to live for tomorrow. Top that with don't give up hope. It's never too late. And you only fail when you quit trying.
Yeah, really good point. Well, we want to do a shout out to a couple of folks. Dr. Jesse Rocky Romero came on today, and he says, great interview. So you get a thumbs up from our esteemed colleague, Rocky, who, as you can imagine, is very, very instrumental in helping many others in terms of recovery, and he himself modeling that. So thank you, Dr. Romero, for joining us, and shout out to Fernando Gonzalez, because I like what he said. He says, thank you, Nalba, and especially to Mikayla. What an enthusiastic and motivational presentation. Mira, so if your colleagues are saying that, all we're doing is burying back the energy you put out, because part of that is that all of us, as Socorro says, she said it in Spanish, so you know, this is a bilingual program. So si alguien quiere hablar en español o tiene preguntas o comentarios en español, so anybody who wants to participate and make their comments or have questions in Spanish, they can do that here. In other words, Spanish is welcome here. Your culture is welcome here. Your life experiences are welcome here. So this is what she says. Sí, todos necesitamos consejos. Yes, we all need advice. And what a perfect way to end today's presentation. But Ms. Melissa, please close us up, because I think, you know, you connect the dots for us, because you're always looking to say that for the people who are really building this movement, there's a movement in New Mexico that's alive and well right now, by the way, because you're right. I remember being at the front end of this back in the 90s. And then we were trying to establish ways to give people with mental health conditions a voice, a venue, and a vehicle for feeling that they can have power over their lives, because they were feeling pretty powerless, because the system was designed that way. But anyway, they've been chipping away at it. And then now today we have peer specialists that are really empowered, because back in the 90s, we were training the consumadores, as we would call them, what to do to feel that they had power. You know why? One of those recipients of services was my sister. And you know what? I would not dare allow anybody to take her power away from her, right? Because guess what? Many people are trained to take people's power. And so the powerless then are the powerful now. But Melisha, wrap us up and ya está.
Gosh, how can I top that? The both of you, and then the comments from our own Dr. Rocky Romero. Ooh, that's a big, powerful person there. And he was here not too long ago with us too, and tears everywhere all the time. I love you, Mikayla. I can say that, because I feel it. And you too, Mr. Fred and Victor and everybody out there in Facebook world who got to listen to Mikayla's story today and her message that people in recovery do, people like us do recover. We go on to be whatever we want. We have choices and options today. Our backgrounds, our biggest motivators, and we're on fire. And I think what you spoke about today hopefully will open doors for people that think or thought that they can't. We can, and we do survive, and we go on to be amazing advocates in our communities and giants. So thank you. I'll throw a plug out there for the 24th and the 25th at the Buffalo Thunder and Fred said it perfectly, behavioral health stars. Folks recovering from so many, but have made from our, mental health and or SUD, but folks that get to work in the field and help us grow. And there's stars out there who have been doing this for years. And they're the giants that we get to mimic and be part of. So we're going to honor some stars this year at the Buffalo Thunder. Thank you, New Mexico Behavioral Health Planning Council, Natalie Rivera, and that whole team and everybody behind the scenes doing all this. The 24th and 25th, all that stuff's on the Facebook. You can register. Also, end of business today. That's when registrations close. So anybody wanting to do that, please come and join us. And at the Roundhouse on the 25th.
Oh, that's awesome. Yeah. Thank you. What a perfect way to say, and we still have more to do. Okay, that's right. You have the recognition event on Tuesday, Behavioral Health Day at the Legislature on Wednesday. I'll see you there. And more importantly, Mikayla, muchísimas gracias. Many thanks to you. Continue this great work that you're doing. We're going to be very interested to see how your path continues into the future. And to all of you who came today to listen into this live Facebook event, I'll say muchísimas gracias to you because you help us to influence others and to get the word out. And this is a process where we continue to grow that. And so with that, have a great day. And ahí nos vemos. We'll see you soon. Thanks.
Thank you.